Welcome to the KellFire Show. I'm Dr. Kelly Barron, and today I am so excited to have Kathy Cates, pelvic and sexual health nurse practitioner. I think this is a subject we definitely don't talk about our pelvic floor enough, and I think it's one of those subjects that everybody does want to talk about. They're just too embarrassed to talk about it. So Kathy, welcome. I'm so excited today to talk to you, and I'll probably stare at you the entire time, just fascinated. But why don't you just give us a little background on what you do and why you became a pelvic floor specialist?
Totally. Well, thank you so much for having me, Kelly. I'm delighted to be here, and this is going to be so fun. So, I am a family nurse practitioner, and I was working at a federally qualified health center running a sexual and reproductive health program. And I developed significant pain with sex, which the medical term for that is dyspareunia, after I went through treatment for breast cancer. And I did not know how to help myself. And I ran a sexual and reproductive health program, and
Yeah.
I didn't know how to help myself. And I thought, oh goodness, that's just not. I thought, did I miss the lecture that day? And I was like, no, I think there just wasn't a lecture. And I'm incredible, I'm a medical professional. I'm privileged to access very good medical care. And it took me a long time to find the right team of people who could help me. And that didn't seem okay. So I myself became a pelvic floor therapy patient. And from that experience, realized that the pelvic floor assessment of the pelvic floor really can be within the wheelhouse of all clinicians who do pelvic exams. And it's not something we're taught in school.
I,
So
that's
that story is really what prompted and fueled my passion, number one, to start my own practice in pelvic and sexual health. Because I think as a patient and as a provider, I had so much that I could share with patients in taking care of them. And number two, my second passion is education, providing education to pelvic health education to clinicians. So I co founded an organization called the Institute for Pelvic Health. And with a dear colleague, a pelvic floor physical therapist, she and I created this. And we provide pelvic health education for clinicians who do pelvic exams so that my goal is that the first time you go to your provider, whether it be the gynecologist, the PCP, your internist, that they do an appropriate pelvic exam so that you can get the right diagnosis in that very first office visit. So those are my two passions, taking care of people's pelvic and sexual health and educating clinicians.
I would probably tend to say there's thousands, if not millions, of women who we own a pelvic floor. We carry this sucker around everywhere we go, and we don't know enough about our own body. And we experience things like this, and we don't do enough research ourselves to understand our body, and we just go to the doctor and we just hope and pray that someone's going to figure it out, give us something, or tell us what to do, and on our merry way. I also don't think that if you say the word or the phrase pelvic floor, that we even know what that means. No, our moms don't tell us what are the parts that make up the pelvic floor. So it sounds like a very elementary question, but I'm going to ask it. If
It's
you
a
could
great
just kind
question.
of give us a definition of what the pelvic floor
Totally.
is and why
Yeah.
is it so important?
Yeah. So the pelvic floor is the grand central station of the body. It sits in the middle of the body. So if you're going from the top down or from the bottom up, it's right in the center, which is why I call it the grand central station.
I love that.
It does so many things. It supports urinary health, it supports bowel health and sexual health. And it also helps us transfer weight load again from the bottom to the top or the top to the bottom. It's incredibly vascular and acts like a big lymphatic pump, actually, for the pelvis and the whole body. super cool. And it really provides structural support. So those are all the things that the pelvic floor does.
So, how does the pelvic floor anatomy,
Mhm.
function, health change over the lifespan of a female?
Yeah, that's a great question. So I would say with people with vaginas and vulvas, as they go through, it's a great question. So as they go through different stages of life, that can affect the muscles and the tissue of the pelvic floor. As people take certain medications, it can affect the pelvic floor. And so if you think about stages of life, if you think about like on the path to menopause, especially for your audience, Kelly, in perimenopause, menopause, that path to menopause, there's so many hormonal changes. And the vaginal mucosa, the lining of the vagina, as well as the on the outside of the vulva, that tissue in between your labia minora, it's called your vulvar vestibule. Your vulvar vestibule and your clitoris and the inside of the vagina are dependent on hormones.
Ah,
They're dependent on estrogen and androgens. And when I say androgens, I mean like DHEA or testosterone or those are androgens. DHEA is a building block of that turns into testosterone. And so anytime, like life cycle, if you're breastfeeding, for example, you have decreased estrogen levels that will dry out the tissue of the vagina, of the vulvar vestibule, and of the clitoris. And that when you have dryness of the tissue, it creates tightening and shortening of the pelvic floor muscles. So, breastfeeding, changes associated hormonally on the path to menopause, certain medications that patients take. Well, anything that's going to dry out the tissue, it's not going to just, if you're taking an antihistamine, it's drying out your nasal passages, but it could potentially have an effect on your vulvovaginal tissue.
I, okay, I'm
I know.
now fascinated. I'm fascinated.
Yeah,
First of
yeah,
all, I
yeah,
breastfed for basically 6 years straight 'cause I had three
yeah.
children, never stopped.
Mhm, mhm.
Never knew that about breastfeeding
Well, that's
at all.
because we all know this clinically because we see it. However,
Mhm.
the first research article in July came out giving it a name, which is called the genitourinary syndrome of lactation. Now, people on the path to menopause will be familiar with the genitourinary syndrome of menopause, right?
Right.
So the reason that you probably went through 6 years of breastfeeding is because nobody knew, right? It's July of 2024. The first paper came out addressing what we all know in our practices and we see all the time. So anytime there are hormonal changes, be it for where you are in your phase of life or a particular medication that you're taking, that can have a direct impact on the muscle and tissue health of the pelvic floor and the vulvar vestibule and the clitoris.
Now, if you are passing through perimenopause, you're through menopause, you're postmenopausal now, is that something that the tissues will, I don't want to say change back, but have you now lost because estrogen is low? Like this is an issue. I don't want to say it's an issue. It's just where your pelvic floor is at this point.
Right? I mean, there's a wide spectrum, so it depends. Some people go through are on the path to menopause and then in menopause and have no symptoms, right? So that's
Right.
fine. And when I talk about symptoms related to the pelvic floor, I'm talking about urinary symptoms, feeling like you have a lot of burning or you feel like you have a UTI, but then you go and you get a urinalysis and you don't. It's because you have estrogen and androgen receptors on your bladder and on your urethra. So again, when you don't have the estrogens and androgens on board, just because your ovaries have stopped producing as much estrogen and
Right.
testosterone, which is totally appropriate if you're going through natural menopause, right? Surgical
Mhm.
menopause is also very important to talk about, but it's a little bit different. But my point is that I think I lost my train of thought a little bit.
That's okay. I'm still fascinated. I'm still with you.
Yeah, anytime there is hormonal changes, the tissue is going to be, oh, I know, affected. And so, for example, the urinary symptoms, right, that you never had before, and all of a sudden it burns when you pee.
Hmm.
That is usually an indicator that you don't have the right hormone balance of your vulva and vagina. You have entry pain with penetrative activity and you never had it before. Why? Because if that tissue at the entrance, the opening of the vagina and the surrounding tissue, remember that vulvar vestibule, if
Right.
that tissue is dry, that's going to make the muscles contract and shorten. And then it's going to hurt if you're trying to put something in. I always think about the vagina like a hallway. This is what I tell my patients all the time. It's like a hallway. And when you have shortening of the muscles because of dryness of the tissue, the hallway gets narrower. So then you're trying to put something inside of a hallway that's narrower and passing through tissue that's dry. And a lot of times for people, that will cause a lot of pain.
I don't know why, but so as you're saying that with the hallway, I'm thinking of also like a very similar. Like if you are trying to get a couch or a chair in a doorway and it's too wide and you're trying to angle it and push
Yeah.
it, it makes so much sense. I love the analogy you did.
I love your analogy too.
Yeah, it makes sense now because I think we just don't understand why. We go, okay, well, it's going to be painful. And maybe we assume that's because of dryness, 100%. But actually, what you're saying is the combination of dryness and the fact that it shortens.
What does the dryness do? It makes the muscles shorten and contract.
Right. I think if you think like dehydration or things shrinking, if you put them in the dryer too long, they've lost all
Yeah,
that. Yeah.
yeah,
So,
totally.
okay. I,
And I think just because people think, like a lot of these things, people think they're common, right? These are common symptoms that people have. And I would propose that we stop accepting that that's normal because like that's just a normal thing that happens when you breastfeed, or that's a normal thing that happens when you go into menopause. And I say absolutely not. These are common symptoms that there are solutions for.
I, I, I think that we should all embrace that. Stop accepting like, oh well,
Right.
and start
It's
and
not
start.
like, I mean, think about it. They keep like pads in like trampoline parks, right? Like we all take our kids when they're little to trampoline parks. You go in the women's bathroom and there's always like a basket of pads. Now, I find like you might be getting your period, but a lot of those pads are for all of the leaking that happens when people go on trampolines. And
Oh
we
well,
think that is normal.
that's something we could get into in a second because I don't think I have a friend currently in this age group. I'm 53, anywhere from mid 40s to and up that doesn't have a story or 10.
Yeah.
But um, we know now that estrogen plays the major role in this. What about stress or lifestyle habits? How does
Oh,
that affect pelvic floor health?
so it's a great question, and I will answer it in two parts. Stress, number one, what is when we're stressed, what do our muscles do?
They tighten, they tense.
They tighten and tense. So it's not just what we think of as muscles, like in your arm, in your leg. You have muscles in the within the pelvic girdle, the pelvic cavity within that grand central station. So guess what? Those tighten too. Number two, when you are stressed, you do not use appropriate breathing mechanics.
Mm.
So, and I would say this is and I think one of your questions will be like, what's the one thing that you want us to know about the pelvic floor? And here it is
Okay,
that
let's go.
your
Give me some.
diaphragm Your diaphragm, if you put your fingers on your ribs and there's a point in the center where the ribs come together right underneath the breast tissue, that's where your diaphragm sits. That's the top of it. Now, when you breathe in, the diaphragm, in theory, should go down. Here's my diaphragm and here's my pelvic floor. They should work in concert, right? The diaphragm goes in when you inhale, the pelvic floor muscle drops, lengthens, relaxes. And when we can't breathe, when you're stressed out, you can't take a deep breath. Your breathing mechanics are impacted. When your breathing mechanics are impacted, your pelvic floor can never, your diaphragm never descends, so your pelvic floor never relaxes. People understand the idea of like a frozen shoulder. Everybody knows what that means. It's a shoulder that can't move. So when you're super stressed, your diaphragm is frozen. And when your diaphragm is frozen, so is your pelvic floor. And it's usually frozen in a clenched position.
So we can, and maybe this isn't the right analogy, but I'm picturing, and I think this was from way back when you first learned about Kegels. I'm picturing the diaphragm pelvic floor. It's an elevator, and if you're not breathing properly, you've got stuck on floor two, coming
Oh,
down. You didn't get to the lobby.
oh, you're like, if you're stuck with your diaphragm, you're like on floor five.
Oh, of like 72. But
And
I
so
think like I just,
that is a big problem about if you're not breathing appropriately and your pelvic floor muscles are sort of frozen in a contracted state. This is why this is another one of your questions. Like, this is one of the big, it's wonderful that there's more emphasis on the pelvic floor and pelvic health, like on the national stage right now. But Kegels are not a one size fits all. And
yeah, that was one of my questions. So
I
you
know
go
it's one of
ahead.
your questions, right? And it's a very important question because if you have muscles that are tight, like if your bicep muscles are tight, right? You can't get a bigger bicep muscle if your biceps are so tight that you can't contract them. Like they're at their maximum. And you all want that like sexy ripped bicep. You can't get it if they're super tight. The way that you can build a beautiful, sexy bicep muscle is by relaxing the muscle and then contracting the muscle. So the problem with the when with Kegels is that if you are someone who has very tight pelvic floor muscles and then you're trying to contract them, you can't do that. You can't strengthen muscles that are tight. So that's why it's not a one size fits all.
I just, when you were saying that and we were talking about the elevator,
Yeah.
I I took a deep breath in. I'm like, all right, concentrate while she's saying that and relax. And if we all learn to do that, like you can feel it in your pelvic floor. Once you relax, you can feel your pelvic floor relax.
Yeah, your pelvic
And
because the pelvic floor muscles sit in between the pubic bone and the sacrum and the tailbone. They're a sling of muscles. And so when we breathe in and the diaphragm fully descends, drops down, those pelvic floor muscles in between your pubic bone and your tailbone, they lengthen. And lengthening is analogous to relaxing.
I like the if picturing the sling. It
Yeah.
helps. It helps when you're thinking about what's going on.
And
And
people sometimes like also like lengthening, people like widening. People like to think that as the diaphragm descends, the pelvic floor widens.
oh, I can feel it. Not to TMI that I just tried that while you were saying it. I was following along, but
Yeah,
you can feel it do this,
totally. So it's
and
you just
everything else relaxes.
exactly. And so, diaphragmatic breathing is amazing for your pelvic floor and also your whole your whole being. It's just a wonderful thing to incorporate into your day to day.
So that was my next question. So if there's anything you want to elaborate that, it was what are the simple daily let's take the Kegels and we'll put them over here. We all know about them and how to do them and get at the stoplight and do as many as you can. But what and now diaphragmatic breathing. What does that look like? Are there other daily practices that we can do for pelvic floor health?
So I love the diaphragmatic breathing. I love laying down on the ground if that's accessible for you, or on your bed, or sitting in a chair if it's not easy for you to get down onto the floor, and just having your pelvis, the back of your pelvis or your sitting bones feel supported, your back feels supported, and your head feels supported, right? Like all of those muscles in your head, your back, and your shoulders, they all work so hard during your day to have you do everything, and we all need, I like to call them gravity breaks. Like we need gravity breaks to just reset. And I think when you can reset your musculoskeletal system by laying down or by sitting still and you can actually breathe, that's the most important thing. There are a
Well,
number of stretches and stuff, but the most important thing, and people need actionable steps. So if you can lay down and do 3 slow diaphragmatic breaths, when you say, I inhale, my diaphragm descends and my pelvic floor lengthens and widens, and you can do that every day 3 times and build from there so that eventually you get up to 10 times a day. That's it. It's a beautiful place to start. And everybody can do that, and you don't need to buy anything, and you don't need to go anywhere.
no, I'm thinking like it's a really great way to either alarm goes off, you wake up, don't
Yeah,
move. Lay
yeah,
on your back and get your 3 to 10 in, or when
yeah,
you're going to bed. It's so
yeah.
simple,
It's
and
so
we're not doing it.
no, I have a colleague who, if it's helpful for your audience, she started a website that's called Women Living Better. I don't know if you're familiar. Do you know
No,
about?
but now I'm definitely going to be
Oh yeah,
familiar.
and so she's not a clinician, but she's a passionate person, and she has a business background, and she's super smart, and it's an evidence-based resource to support women on the path to menopause. Because it's so hard for us to find science-backed information when it comes to the path to menopause. It's such a challenge. And anyway, and so big shout out to her, Women Living Better. And I did a whole, if you just, we did a pelvic floor section on there, and I talk through the diaphragmatic breathing. If that's helpful for your people, you can maybe link it in the show notes or something.
Yes, I think that's
Yeah.
huge because everybody's gonna.
Have her on your show because she's
Yes,
awesome.
I'm gonna reach out because I think that that's fascinating.
Right.
Um, Urinary incontinence,
Hmm.
really, that's probably when people think about pelvic floor health. That's probably their first go-to. They think about, oh, I would say like painful sex,
Hmm.
vaginal dryness, and urinary incontinence. And I
Yeah.
think that's the one that's both play a huge part in our mental state, how we feel, how we look at ourselves. But
Yeah.
that one is a big one. And
It is a big one.
I feel like, well, I'll let you talk about it first, and then I'll tell you how what my thought process has become on that one. But go ahead, and if you can give us a little, background on what's going on there, and maybe even some tips we can talk about.
So I think urinary incontinence is what we call multifactorial, meaning it has different reasons. It's usually not just one thing. I think that of course, remembering that we have those estrogen and androgen receptors on the bladder and the urethra. And so when there's dryness, there's going to be tightening and shortening of all of that tissue, and that can exacerbate, like for example, the menopausal woman who never had incontinence until she went through menopause, right? That's a classic. And so that's a pretty simple, like straightforward reason for incontinence. And then I think there are more complicated reasons for incontinence. I think that, a common reason it might happen after pregnancy in the postpartum period or even during pregnancy is because there's a lot of simple biomechanics, right? For every force, there's an equal and opposite force. And so if you're increasing the weight of the uterus, like really moment to moment in pregnancy, you're putting more and more weight load on the muscles of the pelvic floor. And so they're going to respond to that weight load. Here's the biomechanics part. And they're going to respond, and they're usually going to contract to try to combat the downward pressure that they feel from the ever growing uterus. And then sometimes, from being in a state of contraction all the time, like they just get tired. It's like they get blown out, and then they can't provide the support that you need. And urinary incontinence, it's also important to understand there's two different kinds. There's stress, like the jumping on a trampoline, the coughing, the sneezing, that's stress urinary incontinence. Then there's also urge. That's when you have to pee and then you leak a little bit of urine. And then there's also mixed, where patients have a combination of both.
So what can we do? Um,
So I
we
think doing your best to not have too much weight above the level of the pelvis, pressing down. I think that's a big thing that we can do. So try to stay active, right? So that we
right.
don't have all of that extra weight. And I think that diaphragmatic breathing is very important, because remembering, if we can get those muscles to relax, then we can get them to contract. And the other key relationship of pelvic floor motor control is a fancy way of saying contracting and relaxing, is the relationship of the pelvic floor muscles to the transverse abdominis, or your low belly muscles. So, what you can do is work on building your core strength, because when you build your core strength, you can start to develop pelvic floor strength without overdoing it by just doing like a bunch of Kegels, and then essentially like just doing too much. And then probably if you have a tight pelvic floor and all you're doing is Kegels and you have incontinence, you're probably going to make it worse.
I was like, okay, this I know I have a question here about this, about fitness. And I'm like, there it is. And she's talking about it because I was very curious if fitness, and you just pointed it out, if the way that we always think about working out aesthetically or for bone health or for overall quality of living, but I wanted to see if you could connect fitness and pelvic health, and you just did, and you just
100%.
made my heart swell because
When you're active, right, and when you're whatever kind of exercise you love to do, it has all of those benefits that you said, and you're also increasing in blood flow. And remember that pelvic floor is quite vascular,
Mhm.
right? And remember that tight muscles also lack blood flow.
Right. It's so very, I'm going to get back to the incontinence,
Yeah.
but you just made me like a light bulb went on. Gut health seems to be like we're talking about that a lot now. How gut health is this center of the universe. It controls
Yeah,
cortisol, hormone, like everything happens in the gut. But what we're not talking about, which you are, is Grand Central Station. It's
to-
not just gut health. The pelvic floor plays such a huge roles for females, and
totally.
I'm now going to obsess about this topic.
And the other thing I would say that people usually don't make the connection is that pelvic floor health and bowel health, so this is related to gut, are huge. Because if you have very tight pelvic floor muscles, it gets harder to pass the stool for some people.
Okay,
Because
now I'm
in the
fascinated.
back of the pelvis. All right, so if you, because people are listening, right? Not watching? They're listening. Okay.
They're both. They're watching also on YouTube.
All right, I'm just trying to think of a, right. So if you hold your arm out at 90 degrees and then put it in front of you. So you've got your shoulder and you've got your elbow.
Yeah.
And then, yeah, now you're going to put your hands down. Perfect. Okay. So this is the rectal angle that sits in the back of your pelvis, the
Okay.
back of your pelvic floor, just like this. These, if you take your thumb and index finger on your opposite hand and wrap around those muscles, those are your pelvic floor muscles. And if you have hard stool, like if you have pellet-like stool that's hard to pass, or like if you haven't pooped in a couple days, all that stool is building up here. And guess what? It's the same thing, right? It's like those pelvic floor muscles are going to start to really work against the pressure of the stool sitting in the rectum. So that's why we recommend a squatty potty, or getting your knees higher than your hips. Because as soon as you get your knees higher than your hips, you straighten out the angle. So then mechanically, you're making it a little bit easier to try and pass the stool. So it's like there's so many things that we can do on a biomechanical level to make it easier to pass stool and all these things. And I love the low hanging fruit. Like you grab some yoga blocks, you bring them in your bathroom and you get your knees higher than your hips. You got your DIY squatty potty, you're good.
Right, because one of my biggest issues, totally off topic, is, I heard all about Squatty Potty and I understand the benefits, but it's ugly. And if
Yeah,
we could just
totally.
take two yoga blocks out and use those, why wouldn't we?
And then you can move them away too, right? Because not everybody
Right,
has
and then they're out of the way.
where you want to, if you're traveling, use a trash can. Like there's always something that you can use. And I think once you understand that getting your knees higher than your hips will literally change that angle, it'll take an angle and straighten out the angle. It's gonna make it easier for the stool to pass.
For those that are watching us on YouTube, or for those that are not, they should see my face because I am completely fascinated now. I
Mhm.
This makes so much sense, and I didn't know, and I'm ashamed I didn't know this, that the pelvic floor muscles wrap around like that,
Yeah,
and now things make so much sense.
yeah.
Why everything's so interconnected, and now,
It's so connected. And so for optimal pelvic floor health, you need to be moving your body every day to, have sufficient blood flow. You need to take those diaphragmatic breaths. You need to make sure you're doing some kind of moisturizing if you've got dryness, and you got to try to have a soft formed bowel movement every day.
I you're hitting my heart right now. If we could all do that, that would be awesome.
I
You're
mean, it would,
speaking my language.
yeah, totally, right? I mean, it's easier said than done.
It is, and
Yeah.
I feel like a lot of our male counterparts are completely blindsided when they find out, oh, it's not like 1 to 3 times a day for you. And for the lucky females out there, like I bow down to you. But going back to incontinence, and you can tell me if you're wrong. As far as from a mental state, and also it fascinates me now because we can talk about bowel movements, and also that can get to a woman too, or whoever is having issues with that. But
Totally.
I learned, or I told myself, and you've absolutely backed this theory up, is that it is a natural part of life. And instead of, I know I have a lot of friends that won't do certain activities because they'll leak or they'll be incontinent. So jumping jacks or an exercise, or for
Yeah.
me, laughing really hard.
Yeah.
And at first I used to be just so embarrassed and I didn't know what to do, and I wanted to avoid situations like that. And then I said, you know what? No, it's normal. And yeah, it might happen in the middle of a grocery store. I might laugh, or I might be somewhere, but we should normalize it instead of demonizing, or I shouldn't say demonizing it, making it like an uncomfortable situation, unfortunate situation. I think we should just say, hey, this is our bodies held babies if they did, or wait, gravity
Totally.
did its deal.
Yes,
This is a normal part of life. Um,
absolutely.
so I'm glad we touched on that one. Are there any common myths or misconceptions about the pelvic floor health that you come across?
Yes. Kegels are not always the answer. And um, vaginal estrogen, which is the bioidentical vaginal estradiol, is safe for every person with a vulva and a vagina.
This is a good one because this I hear often too, where women are very afraid. They're not sure if they can, if that's something that they can use. Is that something they should consider?
Right. So there's a big movement afoot, and maybe you can also pop that in the show notes to get providers and patients to there's a petition to write to the FDA to get the black box warning removed on vaginal estrogen,
Mm.
because right now it's got a black box warning on it that it can cause cancer. And it's not true. And we have research studies now for days. And when I say vaginal estrogen, I'm talking about local hormone therapy that you apply either as a cream, as a ring, as a pill inside of the vagina. And then if it's a cream that you're going to massage into the tissue of that vulvar vestibule and into the clitoris. And it is safe. And I think that is a huge myth, and we've done such a disservice to women. And I will share that I had breast cancer and I used vaginal estrogen. And I feel 100% confident, as do my medical providers, because that's what the evidence says.
That's Thank you for sharing that. Thank you for
You're
being
welcome.
open enough to talk
Yeah,
about that.
yeah,
And see, there you go. Like you've done, this is part of everybody. What works for one doesn't work for the other, or what you might be a candidate for, some other people might not be. But it's doing your research, and
totally.
you are someone who's had cancer, and you have
Yes.
a medical team that's looked after you, cared for you, and they're saying it's okay. You did the research, you made the
And I
choice for
have my
you.
own research, right. And I also will say, because I want to be very cognizant that some people still will be very nervous about that. So even though like it's 100% safe, I still do sometimes for my patients, I can tell that they're just not comfortable with that, even though all of the evidence supports that it's totally safe. So there are some studies that have shown that hyaluronic acid is as effective as vaginal estrogen. So I want to just share that with your listeners because I want to be thoughtful about not everybody, even though it's safe. This
Right.
is where the shared decision making comes in, and you really have to listen to your patients. And some people, especially people, that have had cancer, they're just very nervous. And so there are alternatives, I guess, even though it's 100% safe.
So my next question was going to be, are there any holistic or alternative therapies that you would
Oh, for
recommend?
sure. Absolutely. Yeah, there are, again, the hyaluronic acid, right? It's a collagen booster. Most of us are
Ah,
familiar with it because we put
yes.
it on our face, because it boosts collagen production. Well, you have collagen on the lining of the vagina and on the vulvar vestibule. So it's going to help, but that's why it's helpful.
So that topical. So if someone was taking a collagen supplement or things like that, that's not the route we're talking about. We're
And
talking about
we're
like a
talking about, that's
topical.
a great question. We're talking about topical.
Okay.
Some of it, if you're taking it systemically, might get into that tissue, but I don't know that we really know about that. And we do know that topical hyaluronic acid can be incredibly effective. So that's a nice option for people.
Are there any foods or types of diets that are more beneficial, or you could go the other way, that are least beneficial for your pelvic floor health?
I think that's a great question. And I think, you know, anytime you can be thoughtful and you can have like not a lot of refined sugar, not a lot of white, any of that stuff that we know can lead to inflammation, you're just better off without it,
Okay.
right? Just like you are for your whole body, like so is your pelvic floor. You want like healthy muscle and tissue. So the way that you would eat for that and the way you would move your body for that, it's the same for the pelvic floor.
Okay. That
I
that
think
makes
for
sense.
and one thing about if incontinence or any kind of urinary symptoms, we always want to make sure you're thoughtful about the four C's and avoiding them. Um, Carbonation, chocolate, caffeine, and citrus. Now, let me explain.
Okay.
Yeah, you can have some chocolate, but it's like, how much are you having every day? You can have an orange, but like, are you having 5 glasses of orange juice a day? Right? Like, just being thoughtful about those. But I love the low-hanging fruit. So if somebody comes in and they're like, I drink 3 seltzers a day and I have urinary issues, I'm like, okay, well, let's cut back on the seltzer and let's see where we are, right? Because that's a doable change. And again, I love the low hanging fruit where you don't need to take a medication, you don't need to go anywhere else, you can just
Right.
do these lifestyle changes.
It's a very easy, actionable step that we
Totally.
can.
Like making
take.
sure you get enough fiber in your diet because we know that getting enough fiber promotes soft form bowel movements. And remember, we love that for your pelvic floor.
We do. I'm gonna. That's gonna be my new bumper sticker. We love fiber. We love it for our pelvic floor.
Right. So,
And water, I would say that. Would you
yes.
say, getting enough
Yes.
water for that and for just as we're talking about tissue and tissue
Okay, for
health?
tissue health. Yeah, 100%.
So a question I have that just popped into my head was, if you're on any kind of social media or Instagram, I don't know too much about Facebook, definitely on TikTok, all the rage now is the 52 products we have for our vagina to either make it feel smooth or smell great or look young or whiten or this or that. Should we be doing that? Again, I know it's a personal choice and you do your research. I'll put that out there.
I would say actually I'm going to be more forward than that. Your vulva and vagina are an amazing self-cleaning oven. You don't need anything. Warm water. And we
Really?
have been, people with vulvas and vaginas have been told, have been marketed to. It's part of just kind of the society and the culture. It's embedded now that a vagina and a vulva are somehow dirty and smelly. I mean, it's all created. Again, the vulva and vagina are an amazing self-cleaning oven. It's also totally normal to have physiologic discharge sometimes, just like white or clear discharge, totally normal. And it's totally normal that you might have different smells sometimes. What's not normal is if you have a very strong fishy odor. If
Right.
that discharge is yellow or green or foamy, those are not normal. But the rest of it is all normal, and we have just been marketed to.
I was going to say, I would probably, yes, the cleanliness, odor is probably one of the biggest ones.
Yeah.
I mean, you'll know better than me, but from what I see, read, hear, or told from friends, like like your odor, everybody's ashamed of it. And I think if we start looking at it and going, no, that's what a female is supposed to smell like, and that
Yes,
it's not
100%.
a bad smell.
No, it's not a bad smell.
Well, good, because I'm glad it just everything now. You can smell like a peach, and you can smell like, lemon zest and lavender, and
No, no,
it's
no, 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 no. Remember,
and
amazing self-cleaning oven. And if you use stuff like that, you're disrupting the vaginal microbiome, and then you're going to have a whole host of problems.
and the pH and things like that.
Totally. I mean, it's just like horrible.
I'm so glad you cleared that up for me. As as I go into my cart and get and delete my cart of fresh smelling things.
Absolutely not. No. Mm-mm.
Um, what is, what advice would you give to a woman? And this is there's the whole host of things we've talked about, but what advice would you give to a woman who feels like there is that she's experiencing pelvic floor dysfunction and like I said there are multiple things that fall under that umbrella, but we tend to be really embarrassed or we don't know what to do, we don't even want to talk to our doctor, but what would you say?
Such a good question. So try to find a provider that you can talk to. You can look, uh, and I think try to find, if you're able, try to find a pelvic floor therapist who can help you. Um, if you just Google like how to find a pelvic floor therapist, there are 3 or 4 different uh, websites that you have directories. You just type in where you live, and hopefully there's someone near you. And then I would say you can start with your primary care provider or your gynecologist. And if that's not helping, I would recommend going on, it's a professional organization called the International Society for the Study of Women's Sexual Health. The acronym is ISWISH. And I think you're muted now. And
Yeah, I am.
okay. And there's a provider directory on there, and I'm a member, and those people, they're amazing. And they're just they will listen, they will validate, and they will take good care of you.
um, probably one of my final questions for
Yeah.
you before a couple of fun ones, and then opening the floor to anything you want to say would be for women out there, and myself included, who are questioning what if you engage with a pelvic floor therapist, what does that mean? What are we typically looking at? Because I think a lot of women are like, well, what do we do there?
Exactly. Great question. So, when you go to the pelvic floor therapist, they will look at you head to toe. They're going to look at your pelvic alignment.
Wow.
And then, if you're comfortable, you will get undressed from the waist down. In my office, we use sheets, that some people use like those little chucks, those pads, but whatever. I'm fortunate enough that we have nice cotton sheets. So you get under the sheet, and then the therapist will look at the tissue health on the outside of the vulva and that vulvar vestibule, and they should look at the mobility of the clitoral hood, meaning does it move up and down over the glands? And then they should do an internal with a gloved, lubricated finger. They should do an assessment of the pelvic floor muscles, checking for areas of tension, any knots. You get a knot in your neck, you get knots in your pelvic floor. And then they'll ask you to, while their finger is inside, they'll ask you to contract and release the muscles so that you'll know about your pelvic floor motor control. And remembering that motor control is just the ability to contract and release a muscle.
Okay, that's pretty intense. Um,
It is intense. Yeah. And so that's not for everybody. And it's totally within your right to say, like, I'm not comfortable with an internal exam. If you have a condition that's called vaginismus, where you have involuntary clenching of the pelvic floor muscles or spasming of the pelvic floor muscles, you can't tolerate pelvic exams. So, that would also be an instance where you wouldn't have that. But, patients are in charge. And there's so many things that your pelvic floor therapist can do. And, pelvic alignment, the external alignment of grand central station is very important. Pelvis means basin in Latin. And so if you think about a shallow basin sitting on a table with water and you want the water level to be even,
oh,
that's
okay.
analogous to you sit on your sitting bones, your pelvis is aligned, and then all the muscles are now functioning, like appropriately functioning muscles are like a still level line of water in a balanced bowl or basin.
That's a great visual.
Yeah,
Like that's a really good visual.
yeah,
And when I was talking about like that the exam is intense, and I meant that in a very positive way,
yeah,
very appreciative and positive way, because again, we kind of get brushed through our 5 minute exams,
yeah,
and that a pelvic floor therapist is really going to look at you holistically from top to bottom, and
totally.
then look at interior, exterior, or internal, external,
Yeah,
and really treat it like you said, like
yeah,
a
it's like a
muscle.
muscle like anywhere else in the body. And the other thing I would say is that it's and if it's helpful, like people can go to the Institute for Pelvic Health. That's my online educational business that I co-founded with the pelvic floor physical therapist. And we have a ton of resources on there, including we have a YouTube channel. And like we have a video that's all about like how do you find a pelvic floor therapist? What happens at pelvic floor therapy? So things like that I think could be incredibly helpful.
Yeah, thank you for
Yeah,
sharing that, and I encourage everyone,
totally.
um, whether whether you have dysfunction going on or not, it's part of your
Prevent the
body.
dysfunction, right? Go and figure out what's going on so you don't have any
Yeah,
problems.
learn your body. We
Yeah,
we we spend a lot of time thinking about our abs and our mental health and now gut health, all the things, and we've rarely do we go, okay, let me, I want to just at least be knowledgeable about pelvic floor health, how it affects my life, how I can maintain, well-being, a healthy pelvic floor. And I could talk to you for hours because now I'm thinking once we get through just like the basic anatomy physiology of the pelvic floor now, and we've talked about incontinence and loss of estrogen and things like that, we could get into sexual health too, because obviously that's the driver there. But for another time, we'll do that. I'm sure everybody's like, no, no, talk about it.
No, sometimes briefly, just sometimes the pelvic floor is the driver, right? If there's dryness, if there's pain. But a big part of my practice is also to help women with the pharmacological piece of low libido, meaning like prescribing medications for low libido. Because I think
Right,
that's something else that nobody really talks about. And again, it all comes down to providers don't get a lot of education about
right.
it. So then they don't know. And then it creates like the patient doesn't know how to talk about it. The provider's like, oh my God, don't ask me. I don't know what I'm going to do with whatever you tell me. And then that creates a very challenging therapeutic relationship with the patient and the provider. So,
Exactly, and I think that that is something that it's another one of those things that we shouldn't just live with and accept. It's
mm,
something that we have a right to
you
to
have a
figure
right
out what's going on.
to define what pleasure means to you and
Exactly.
how you experience pleasure. That is every person with a vulva and vagina, that is their human right. And so
I
a big
agree.
part of my practice is helping people to define what that means and then supporting them with pharmacological help to get there. Because sometimes you just need a little, you need some things to help with that.
Yeah, and you shouldn't be ashamed. You shouldn't be ashamed. We do it again for our mental health. We will, go to pharmacological. I just said that wrong, but it's a mouthful.
You got it.
Um,
Yeah. And I
and
just also want to draw our attention to the fact that there's no one thinks twice. A man with erectile dysfunction goes to the doctor, nurse practitioner, gets a prescription for Viagra, goes to CVS and fills it, totally fine. And
yeah,
that whole exchange does not happen for women.
no, it doesn't, and it
I'm,
needs to.
I'm saying that's not okay. And so a big part of my clinical work is addressing that issue and
No,
providing
I'm on
those.
board. I think we as women need to start embracing ourselves and being that's okay. We take care of the family, the kids, we pour all our attention, we forget ourselves, we just
Yes.
accept and live with. No, it's not okay. It's not okay at all.
No, no. Sexual
Well, on a
healing is foundational to who we are as women.
exactly.
Yeah.
On a lighter note, so and I don't know if this might be a tough one. So if you stumble on these three, we're fine. We'll figure something out.
Okay.
But in your journey as a pelvic floor therapist, or if you had to give it in your journey becoming one, or in your practice, the name of a cocktail, mocktail, doesn't have to have alcohol in it. If you could give it a name, what would the drink be?
Um, Relax the floor.
Relax the floor. Okay.
Mhm.
Any particular, if we go with alcohol, any particular alcohol that would be the main driver of that drink?
I think I would go without the alcohol.
Just go with a mocktail. I
Mocktail.
like it. Just something soothing. Okay.
Mhm.
If you had to give your journey a title, you can make it up, or it could be a movie, a book. What would it be?
Mm. Smashing sexual health taboos.
Like it. Love it. Really love that. All right, the last one. This always gets everyone, so don't worry. Same question, only if you could give it a theme song. So any song that resonates with pelvic floor health, your journey, helping women with this,
If I had to give it, I to pick a theme song.
to pick a theme song. Because we have the podcast has a playlist that I have on Spotify, and I ask everyone for
Mm.
their experience, and it's eclectic, so it doesn't matter what you put on there.
All right, I'm going to go with because I have an amazing 17-year-old daughter, and she and I love Broadway shows. And she just made a playlist, and I've been listening to it, this one particular song, because I think parts of it really encapsulate my journey. Defying Gravity from Wicked.
Oh, I love Wicked. Defying.
Yeah.
Okay.
The lyrics are really for pelvic and sexual health, really quite something.
I am putting that out, so that'll go on the playlist, and I'm going to
Yeah,
listen to it today.
yeah.
Um, I think that's great. Well, is there anything else that I've taken up so much of your time,
I
and I'm
think we
so
covered
grateful.
a lot. I think we covered a lot. I hope this was super helpful for people.
I do too, and I want to encourage everyone to look up Kathy, find your social media. Again, your website. What's the best website for everyone to go to if they want to?
Yeah, so people can go to pelvichealthsupport.com, and then you can find me on Instagram at pelvic floor NP. And then I don't know, I had a video that went viral on TikTok,
Ooh, you're one
which
of the
is,
lucky
oh,
ones.
you know what? It's like one last thing I want to say about pelvic floor health. It was about the size of your speculum, but I don't remember what my handle. It might be pelvic floor.
Oh, I saw your video. I did, and you had the different
Yeah,
speculums.
yeah,
Yeah,
the size of your speculum. Yeah. So
yeah.
clearly that hit a nerve, and I think like something like 1.4 million views it's bananas. But what I love about that is it's getting people to question what happens when they go. And I think my parting words would be use the smallest size speculum possible. Take a look at that video on TikTok. And then you don't have to use the footrests. I have another one on TikTok about that that has like a lot of views too, maybe like 25,000. You don't need the footrests. You do not need.
Oh,
So when you go, ask your provider, just say, could you try it without the footrests?
okay, that's fascinating because I just had a nurse on and we were talking about what happens at the doctor's visit. It was more of like we were very humorous with it. And one of the things that we addressed was those
Good
darn
job.
footrests.
Yeah, no, you don't know. And I can tell you, as a nurse practitioner who has done thousands of gynecological procedures, I only need them for one.
Just blew my mind again.
I
I
have
am,
placed IUDs, done pap smears, checked for STIs, done vaginitis panels, the whole thing without the footrests. And anybody that I train them. You don't need them.
you know how much like less anxiety there would be if this was just known and practiced
And
so
that
much.
is my mission on the earth is to empower patients and to empower providers. Like those are my two things.
Well, Kathy, thank you so much for coming on.
So
You've been
thank
a
you for
wealth of
having me.
information. And I could talk to you forever. I have a million questions running around my brain, as I'm sure everyone does. So please check out Kathy's website, her social media. Obviously, now TikTok. We all got to watch the speculum video.
You're totally right.
Yes, yes. And I just want to thank you. And it has been such a pleasure. And if you love what Kathy and I have talked about, please subscribe to the YouTube, Spotify, Amazon, Apple, wherever we are. And love your pelvic floor. Love it. We should all love it.
Totally. Thanks
All
so
right.
much.
Thank you, Kathy.
Right. Have a good rest of
Bye.
your day. Bye.
Hey everyone, I just wanted to tell you guys about our supplement line. If you haven't already heard, I put a lot of time and effort into sourcing out what I think are the most important things for women's health in this transition in our lives. And we have Dr. KellFire's potions and elixirs. What we have first is a vegan vanilla protein powder. We also have, this is one of my favorites. It's prebiotic and probiotic. It's a greens powder. So you get your greens, you get your fruits, but you do really attack that gut health and balance that out. So I'm a big fan of Thrive. We also have apple cider gummies. If you've ever had apple cider vinegar, you know how harsh that is to take. So we have our gummies, and they are apple flavored, and they're really good. Supports metabolism. We have the lovely collagen and biotin combo in liquid, so it's awesome. You can put it in your drinks, you can put it in your teas, you can just shoot it in your mouth. I love tinctures, but collagen, biotin for hair and nails, because that is extremely important at this time in our lives. 8-in-1 mushrooms, illumination. Love this product. It's 8 different nootropic mushrooms that supports immunity, anxiety, mental state, awareness, focus. This is my favorite baby. And then I probably shouldn't have said that because this one is my favorite baby. This one is bovine glandular. So this is derived from bovine uterus. This is for hormone balance and libido support. This is a staple, and I think it should be a staple in every woman's wellness kit. All of our supplements you can get on mytempesta.com. Just hit the shop link and everything there. You can get it one time. You could sign up for a subscription with discounts and they'll just come to your door. It will spark your wellness journey and ignite your fire.